Hi, this is Dr. Duresti with the Cranial Release Technique. It's Saturday morning, the 25th of May, 2019, 10 a.m. here in New York City. And I wanted to just talk briefly about this picture that I've been using over the years. And I recently had an awakening walking down the street in New York City 2 days ago, noticing how many people would suffer with what we would call forward head position or forward head posture. And again, if you look here at figure number 1, where these researchers claim that when the spine is aligned and the head is over the center of gravity where it should be, virtually there's a line that passes from the shoulder right to the ear, that the head weighs about 12 pounds. And I couldn't tell you how many people just walking around I saw to be somewhere between position 2 and then position 3, and sometimes worse or sometimes a little bit better. So the theory is, as the head goes forward, the estimated weight of the head increases, which does make perfect sense from a physics standpoint. But what about cranial release? I mean, that's that's the point of my video here, is to talk about what about cranial release when you're dealing with these types of problems, which you'll notice many people suffer from. As you walk around and just look at friends and family, you're going to see this virtually everywhere you look. And some of you will say, well, wait a minute, it's just a part of normal aging. But we'll also see people well in their 70s, 80s, 90s that are not position 2, position 3, but are really sitting in position 1, where the head is virtually right over the spine as it should be. The problem is, in addition to you losing height, as you can see obviously here, that as the head goes forward, you lose vertical height. But the real problem is that as the head goes forward, there's more tension placed on the spinal cord, and actually more mechanical tension is placed on the brain. As the head goes forward, there's more physical stretching inferiorly, downward, on the spinal cord and brain, stretching very sensitive neurological tissue. There was a very famous Swedish neurosurgeon by the name of Alf Breig, medical doctor, and he would look at patients who came into him suffering with what we would call central nervous system diseases, things like Parkinson's, things like MS, multiple sclerosis, other neurological conditions, and he would virtually tie the head with wires and pull it back to take you from position 3 to position 2 and hopefully back to position 1. But an interesting happened when he did that with people is that their symptoms reversed. Their symptoms lessened. They got better. Again, what does all this have to do with cranial release? Well, in my experience, and I'm sure in the experience of other practitioners, when you apply cranial release to patients, this forward head position or forward head posture tends to reverse itself. So what a wonderful non-surgical way to help patients with this forward head position come back to what we might call a normal or near normal position, regardless of the age of the patient. Of course, every patient is different, but the sooner we can get patients to receive cranial release, the better. I wanted to make this video again because I saw so many people walking, and many of those people, you saw them with the Parkinson's tremors and the shuffling of the feet and you knew that the central nervous system was just under tremendous mechanical stress. And if there's something we can do to remove or reduce or release this mechanical stress, well, wouldn't that be a wonderful thing? And that wonderful thing is the cranial release technique. Again, this is Dr. DeResti with the cranial release technique. The website is cranialrelease.com. If you're a practitioner and you'd like to learn more about how to learn cranial release technique in the comfort of your home or office, you can click on the online training program on cranialrelease.com. Thank you so much for these few minutes of watching. I hope you enjoy this wonderful Memorial Day weekend. Thank you so much and have a great day. Goodbye.